Well, as we try to attempt to remedy some of the issues of healthcare manpower shortages in South Dakota, it's important to understand why we even think we should do this. Everybody wants to, and I think should have, a personal physician, a physician who knows them as an individual, who knows them in their community, and the physician-patient relationship is still something that's very valuable in society, and especially valuable to you as a patient and to those of us that get to be your physicians. And the reason that is so important is that the end result of that is that you have better health, and we have statistics that show that all the time. If you look across the United States, if you look in the state of South Dakota, there are lots of physicians out there, and it's always been my contention that what we have is we have plenty of physicians. We just seem to have too many of the wrong kind of physicians, and we have a lot of those physicians, I think, in the wrong place. Most of the United States, and certainly most of South Dakota, is rural. Most of us do not live near a big urban center. We live outside of that. And we should not have to have anything less in terms of health care just because we live further away from a major medical center. And the answer to that is to have more personal family physicians in the areas that can take care of the patients that need to be taken care of. In order to do that, I think some of our training programs have to recognize their role in helping to do this. And that's what this program is trying to do. We know that family physicians, as they finish their residency training, tend to practice in an area within an 80 to 90 mile radius. Most physicians, about 70 to 80%, will practice within an 80 to 90 mile radius of where they finish their training. And so if you finish your training here in Pierre, South Dakota, that's going to cover most of what I consider to be the most vulnerable areas in the state for physician shortage, from the North Dakota to Nebraska border, from west to Rapid City to east, all the way to Sioux Falls and Brookings. So developing training programs that produce physicians that are comfortable with living in rural areas, that have the skill set to take care of the people that live in those rural areas, is what this program is all about. I feel very strongly that is needed. I really hope that this program that we're just getting off the ground can accomplish that. Please give us some time to prove that we can do this over the next 4 to 5 to 6 years.